Okay, we're going with this chapter to square one because I remember when we first started this, I started with this chapter because it is only logical to go and talk about critical thinking and explore critical thinking before we explore the other aspects of the nursing process, because critical thinking, you saw it in each step of the nursing process. But this chapter is not only going to talk about critical thinking, it's going to talk also about clinical judgment. So we're going to spend some time in this chapter. There's a case study at the end that I'm not going to go over here. We're going to go over it in class. So I'm leaving it off. So we talked how critical thinking is in every step of the nursing process. And really now you're developing your critical thinking, which is that complex thinking of all these intricate elements that can decipher what you're seeing in front of you: your pathophysiology, your experience, your knowledge of the standards of practice, your knowledge of your scope of practice, your knowledge of what can you delegate or not. Eventually, with time, that critical thinking becomes your autopilot, and it's embedded in your every action, but you don't have it now. And it's not a insult, because the critical thinking as a nurse is a new thing for you, unless if you're a nurse, which you're not. You are in a nursing school, so you're learning that critical thinking from the perspective of a nursing professional taking care of those patients with complex needs. Your patient is not going to be an easy case, well, especially if you work within the healthcare setup. Correct. And so when we talk about clinical critical thinking, we think about what do we do, what goes out in our mind, in the back of our mind, that those processes that we're using, the thinking, I mean, we're using before we do any intervention, because we want to be safe, we want to give quality care, we want to be effective, we want to be efficient, and we want to be timely, and we want to improve patient outcomes. So how can we do this? Is critical thinking only the piece of how we can do that? So like I told you, now when students graduate and thinking critical thinking is going to be, and even decision making, which we teach you in the program, it's one of our elements that we measure. Uh, but there's like a dissonance, a disconnect between these two, and students don't tend to put them together and grab that clinical judgment, say, yeah, that's what I'm doing. So what is clinical judgment? I want to spend a moment on this. This is clinical judgment, like I said before. It's that decision you make based on that critical thinking, clinical reasoning, in the right time, in the right moment. And you sometimes you modify what you were planning to do so that you can get into this. You remember we talked about Tanner and how she spoke about those different levels of nursing, where you start as a novice and eventually you become an expert um, in your practice. And this chapter is not focused really on clinical judgment, it's focused on critical thinking. But I want to take you a little bit, if you allow me, to there's a scientist that talked about clinical judgment, and her name was Lasseter. And Lasseter spoke first about clinical judgment, and she spoke, the first one that spoke about nurses being doing the noticing and interpreting, and how they do their focused observation, and how they can recognize deviation from expected patterns, and how they go and look for more information to put the picture together, so they can so these are their cues, and then they put them together and interpreted them. Once they interpret them, they prioritize those data and they make sense of it. What is it telling me, and then they're able to, once they recognize, to report, this is what I'm seeing wrong. This is what I think is going on with this patient, and then they intervene. One of their interventions to call the provider. One of their interventions to lift the head of the bed up, to pull the oxygen a little bit up, or to pull the code blue and uh, uh, pick up that the patient is going into cardiac arrest. So that takes experience, knowledge, and ability to implement the skills. I know I've seen CPR 100 milliton, but I've never been on the chest of the patient pumping. So those are things. And then the most important thing, so this is you responding to the cues that you noticed and you interpreted, and then you responded to the situation. And one most important part of having that clinical judgment is sitting back and reflecting. Like I told you before, sometimes you reflect in action, and sometimes you reflect on action. And always, when you reflect, whether in action or on action, commit to improve. And this is a key thing that I want you to um, uh, build. When we reflect, we're telling the world that we want to be better. We want to better ourselves. We want to be able to take care of patient in a better way. Why didn't I pick on that electrolyte imbalance? How did I interpret that as shortness of breath when in fact it was decompensation? So look at those situations versus, I didn't pick up that the patient was so anxious when a significant other was there. I didn't pick up that there may be an abusive relationship. I didn't ask the questions that I should have asked. So these are things, when you reflect, you learn and you grow. And these are things you need to build within, be able to notice, be able to interpret, and respond to what you're seeing. And then the last thing is the evaluation. And in that clinical judgment model, they talk more about reflection. So reflection in action. What happened? What um what happened in what did I need to do next? What did I need to do that I didn't do? Uh, and the situation didn't improve. Um, how am I seeing what I'm seeing? Like, I'm seeing the patient um, clumsy and very fidgety when the husband is there. So this is you reflecting in action. Reflection on action. You go back and then um, you think, okay, what could I have done better? What would I do the same if I'm in this situation? What could I have known more to improve my action? What information might have been helpful? What skill do I need to develop? Like, you see that in that code, you could have helped if you knew how to put an IV in, if you're better in collecting blood, if you were sharper in your compression. So that is important, and always acknowledge your feelings. So I feel that that was overwhelming, because once you set that feeling out, you'll be able to grow and be able to overcome that. And I wanted to spend a little bit of time on clinical judgment, just because I'm telling you, this is going to be the new thing that you're going to have to um, live with as a nurse. Not a new thing. This is what nurses do. So critical thinking. What is critical thinking? It is the continual inquiry. I keep asking myself why, and that willingness to dig deeper, and um, um, never build your decisions and decisions on assumptions. Ask, am I seeing what I'm seeing? Is it correct to ask more questions, um, and seek more information? Then when you see those information, interpret them, examine them, and try always to understand the deeper meanings of what the patient is asking you. If it takes to ask them an open-ended question, go ahead and ask that open-ended question so you can get to what you need to get at. Um, your questions are always need to be based on evidence-based knowledge, because you know uh, what is gonna come next, or the complication, the side effects. You're asking questions based on that knowledge, that evidence-based knowledge. So again, reflection, I spoke to you about it. So the critical thing, your book talks about critical thinking and clinical judgment skills as things together, but critical thinking is a component of clinical judgment. Clinical judgment is the end product. Critical thinking with decision making makes a clinical judgment. So the skills that they're talking about are skills that I've been talking to you about: the interpretation, the analysis, the inference, the evaluation, explanation, the self-regulation. But reflection is something that is highlighted, and I want you to become better at reflecting. you know Go back and look at your practice. Look at what you have done, in addition to reflecting on the situation itself, on that process, the nursing process. Look at yourself on why did you do this, and how was it, what was behind it, and um, was it fruitful. And when they say reflection is not intuitive, it means that you need to engage in purposeful reflection. Like say, I want to reflect on this, not because I'm sitting in the bed at night and I'm thinking, oh my God, now it's coming to me. No, I sit in purposefully in a place, and just look at that, visualize that situation, and think about it, and remember everything about it. If you need to write notes so that you can reflect, because the goal is for you to improve, and the only way we can improve is if we reflect on what we have done, um, and what activities we engaged in. um, Obviously, the levels of critical thinking are going to grow with you as you grow in the profession. Not necessarily like 10 years from here, it's not going to be a better critical thinking just because you're 10 years into the profession. Of course, the more you spend time reflecting on your actions, you're going to go from the basic level of critical thinking to the more complex, to the more intuitive critical thinking, where it becomes your nature is to be a critical thinker, to ask the why and how and what, and how can it be better. Are there competencies for critical thinking? So do you think there are competencies for critical thinking? um, um, can they measure it? I remember once in my job they did exercise, and they half an hour every nurse had to go there and indulge in that critical thinking competency. I don't know how useful was that, but you can. And like I told you about the assess or ask, like if I ask you, okay, what are you gonna do with this when this situation comes? Probably when you're in the situation hands on, you can do better, or probably you're gonna do worse. But if I ask you to sit back and write it down, you're in the cold seat, you're not in the hot seat, you should be able to reflect and write. And so that's you um, um, putting your critical thinking on paper. So that's one thing that they do, is that they ask you to um, judge, what would be a better decision for doing this. And that's an area where they do a lot of research around that. And most of the time you're going to see things that are Some people are hard to express their um, reasoning with words and with writing, but they're better in expressing them in action, and so that becomes a drawback. The competencies for the nursing process. Is nursing process a competency? Can I measure critical thinking by saying that this nurse can write a care plan? Would I be able to say so? What do you think? Um, I would say the nursing process is one of the competencies to measure critical thinking, because if you're able to write down a plan of care, that means you're able to think critically and apply what you know on papers at least. Make sense? Because I'm telling you on paper what is my clinical reasoning for this, and that's how I'm gonna act it in action. So your book talks about that critical thinking model for clinical decision making, and uh, they say talk about like 6 components of that model: competence, specific knowledge base, experience, the nursing process, attitudes for critical care, and standards for critical thinking. The competence and the nursing process kind of talk about the uh, base, and that's if you're able to develop the nursing process, and we saw that critical thinking is integral in every step, so you're competent in that sense. Specific knowledge base, you can't possibly be a critical thinker if you don't know the tricks of the trade. If you don't know the pathophysiology of diseases, how can you predict what outcome or how the patient is going to progress? And then experience only makes sense if you know that clinical experience is necessary to be able to gain those clinical decision making skills. You can't get them theoretically. You have to be there and see and live the moment. And then they talk about attitudes for critical thinking, and they talk about 11 attitudes for a critical thinker. And so a critical thinker is confident, thinks independently, is fair, is responsible, is risk taker, is disciplined, is persevere, is creative, curious, integral, humble. So these are uh, components, parts of the attitudes of critical thinking that make the model critical thinking model. So, and your book goes over them, and Miss Laurie has highlighted the most important thing you need to know about them. And the final thing is the standards for critical thinking. There are intellectual standards that guides, how do you do rational thought. This makes sense, this does not make sense. No, wearing the mask does not retain CO2. See, that is rational versus irrational critical thinking. And then you have the professional standards that tells you, this is acceptable, this is not acceptable. And so, and especially our professional standards, they weigh heavily on ethical standards. Um, so even if I think it's smart, but it's not ethical, it is not within the critical thinking model in nursing. This question is asking you, what do you think about the that reasoning and the rigorous approach that demonstrates critical thinking? Can it be done haphazardly? And that's the answer: no, it cannot. And then comes the great question: can we develop critical thinking skills? And I would defer to you to answer this, but I've spoken so much about this. I told you about reflection, reflective journaling, write down what do you think went well, what do you think did not go that good, how can it be done better, what are one thing you could change, what are 3 things you can do better. This is you training your brain to think critically, sitting, meeting with other colleagues, say, okay, What do you think went well here? The concept mapping, putting your mind on a sheet and map it out, is also another way where you're practicing your critical thinking skills. So yeah, I say yes. The answer is yes for developing critical thinking skills. Um, Stress. Wow, why are they talking about stress now? Um, so makes only sense to talk about stress and this nursing profession. It is a stressful profession, and because we work long periods, we work with patients that are very sick. We work with patients that are not happy. So all this is gonna play an impact, and it is gonna be of um, what should I say? It's gonna wear us down. So there is this in box 15.5. There's that evidence-based practice about stress and stress management, and um, and bottom line, they're telling us as nurses that we should seek help on how do we de-stress. And remember, first lecture I spoke about self-care, because if we don't care for ourselves, we're not going to be able to care for anybody else. And then our coping mechanism when the situation is very critical would be compromised. Um, this is again the critical thinking and nursing process going hand in hand, and the knowledge and experience and attitudes and standards are that circle that impact and influence our ability to grow up in our critical thinking analysis and up to the synthesis level. And here they're asking you, last question. Um, The nursing process organizes your approach while delivering nursing care. To provide the best professional care to patients, nurses need to incorporate nursing process and critical thinking skills. Well, that's what we've been talking about for the last 22 minutes. Okay, with that, I'm going to end. The remaining case study we'll discuss in class. See you.